Hi there, my name is Nupur Kulkarni, she, her pronouns from Public Health Policy and Planning. Welcome to the San Mateo County Health Government Alliance of Race and Equity What the HEC series, where HEC, or HEC, stands for Health Equity Champions. We are doing this video series to highlight some of the incredible work that's happening across county health with a particular focus on equity and how that shows up across all the work that we do. On this episode, we're excited to share a year in review. We're looking back on 2024 and some of the incredible work that has been happening across county health. Today we have
Amy Ketchum, she, her pronouns, Aging and Adult Services. And I'm here to talk about the homebound vaccination program. This program has been assisting San Mateo County residents by going into people's homes every respiratory season since 2021. We provide flu, COVID, and RSV vaccines to homebound residents who cannot make it to their doctor or their pharmacy. This program supports homebound individuals regardless of insurance. Without this program, many of the folks that we see would not be able to get their critical vaccines. We continue to prioritize outreach to our clients. This year, our nursing interns contacted our IHSS homebound individuals and provided some education around how important it is to get the vaccines. And we partnered with the Ron Robinson Senior Center at San Mateo Medical Center to be able to bridge that gap between their folks and ours. So we were able to provide vaccines to them. And we're also open to collaborating with other health divisions as well. I'd like to thank our committed and compassionate team, Jen Maciel, Patricia Ari, who are going into people's homes and giving the vaccinations. Our MD, Jeffrey Robinson, who's available for consult when we're out in the field. Our other health partners, Robin, Kamini, and Dow. And most especially our public health nurses in aging adult services who used to do this work prior to us having a program. Thank you so much for your service.
Thank you so much for sharing about this homebound vaccination program. I can tell that it's really important. I'm curious what makes it an important project that you wanted to highlight and share with us today.
I think one of the most important things about the homebound vaccination program is that we do strive for it to be equitable. The equity part of it is very important to us. This is a vulnerable population that have a really hard time getting to their doctor or their physician, and yet they have people coming into their homes that could be carrying illness. And we want to make sure that they're as safe and protected as possible. So that's
incredible. Thank you so much to you and the team for all your amazing work.
Thanks for asking me such great questions. But what I really want to know is, from one of our fearless leaders from the SEED Lab, is what are you up to, Nupur? What is some of the work that is important to you?
Yeah, thanks for asking. So you mentioned the SEED Lab, and I wanted to share what that group is. So the SEED Lab stands for Spotlighting Engagement of Equity Developments Lab. So that is our mini work group within the Government Alliance of Race and Equity that is particularly focusing on how we are disseminating and engaging folks on equity work and equity concepts within county public health. And so one of the ways that we're doing that is through this What the HEC series. And it's important to me because when I think of equity, it's intimately tied to what the work of health is, in particular when we think about governments, right, and just governance, of making sure that we are reaching communities that might be historically or currently getting left behind. And so, one, we want to learn about how we are reaching communities, the services that we're providing, but we also want to highlight those that are doing that work and making, hopefully, some of those connections of how, whether you use the words equity or not, or what it is, you are deeply connected to this vision of liberation and well-being for everyone. And so, yeah, I'm really grateful to get to be part of this initiative.
That's amazing. Thank you.
Thank you.
You have your hand in many areas of the equity work. What else is going on for you?
So within public health policy and planning, I work with a large swath of our staff and leadership on an equity plan for public health. And I'm really proud of that effort. It's been a little over, I think, 2 years at least in the making.
Wow.
And one of the most important parts of that to me is that though the equity plan started before PHPP started their strategic plan, we have made sure that it's an integral part of this larger vision and approach to how we function as a public health system within San Mateo County. I also want to say that one of the things I'm really proud of that we've recently released is a report about the equity plan. So what did it take from ideation, background research, to forming a work group where we have representatives from each of our 9 programs within public health to come up with objectives and identify what equity initiatives might they already be working on, or what needs do they see that an equity plan or a dedicated work group could be an avenue for supporting and implementing. And taking those to identify at least one internal equity objective. So thinking about bringing equity concepts to our workforce, or thinking about an internal process within a program that we may want to enhance. And also having at least one external or community-facing objective. So the program, services, things that we provide to community, are they as equitable as they can be? Or is there an opportunity to enhance something so that it reaches priority communities that we want to reach? Yeah, and so bringing that together, we are starting our year 2 of implementation of the equity plan. And while we're in the process of getting that going, we have just recently released our equity plan report. So that kind of shares what it took to get to where we are today, and what it means for us in the coming years as well. So
yeah, I can't wait to check it out. Sounds exciting.
Thank you. This has been incredible. Thanks for joining me in this conversation, Amy. Next up, we're going to hear from Kiana and Kevin, fellow colleagues from our Seed Lab What the Heck series, to hear what's something that's important to them from 2024.
I am Kiana Hatley, she, her pronouns, and I am with Public Health Policy and Planning.
Hey everyone, I'm Kevin. I'm he, his, and I'm also with Public Health Policy and Planning.
So I would say you and I joined public health within the last year, and very quickly we became involved in a lot of projects that are going on. So I'm just curious, what can you share about some of the things that you've been working on since you joined public health?
Yeah, for sure. One program I'd like to highlight is the Veterinary Wellness Program, and that's a program run by Animal Control and Licensing over there. Give them big props. Dr. Julia Lewis and Lori Morton-Fiesel are doing great work. So as we all know, having a pet could be very expensive for anyone, let alone low-income individuals. So what they're doing at the Vet Wellness Program is they're meeting folks where they're at and providing vaccines at very low cost, most of the time free, so that folks could actually enter shelter and have a chance to be on their way back indoors.
I think it's pretty awesome that we get to know what's happening across health. So thank you for sharing that. I'm curious, what made you share about what's happening in animal control?
So the program has actually grown so much over the past couple of years that they actually needed more veterinarians. And so I helped them produce a video that would help with the recruiting. But also just on a personal level, it was really awesome to learn about One Health and knowing how animal health affects mental health and well-being, and all these different facets of health coexist. And you can't really neglect one and focus on the other. You kind of have to have all go hand in hand in order to create healthy individuals and healthy communities. So it was really awesome to see.
That's pretty awesome.
Yeah.
I will say, reflecting on 2024, one of the biggest projects that I feel most proud of is this actual series of What the Heck. I think launching this series not only supports us creating these different communication channels about what's happening across health, but I really enjoy the part where we get to know our colleagues a little bit more, build those relationships, and look for opportunities to support the work that they're doing. I'm a big advocate that this work is just as important as the people doing it, and we should celebrate the people doing this work. So I really enjoy what's happening with this series, which is one of the many things that I believe we're producing as far as with the communication line. So in the future, I'm really hoping for us to not only build this platform to reach or expand our audience, but my hope is that there will be other tools that as a county we pick up on to just enjoy doing. It doesn't feel tedious. It's fun. It's fun to sit down and say, what's happening over there, animal control? And we heard from Amy earlier with Aging Adult Services. Like it's awesome to get some insight into what our peers are doing. Oftentimes it can feel a little siloed and alone in what we're doing, but sitting here again is just the enthusiasm that comes when we're sitting across from one another. So I am just really excited that I got an opportunity to join this in the time that we did and with the support of our health executives. I really enjoy working with Luis Rogers and Mark Molman when it comes to just thinking about what's happening. And I should say there's so much happening that we may not be able to capture, but that's the important part of this recap to say, like, this is what we're doing. This is what you can anticipate. And then also come join us. We certainly want to open the door for others to join us in these efforts. So, yeah.
Thanks for sharing. We're going to head over to BHRS now and hear what they've been up to in 2024.
Hi, my name is Alex Perez, and I am the lead BHRS specialist on the IMAT team.
Hi, I'm Mark Ross, lead BHRS specialist with my coworker on the IMAT team.
So pretty much what we do is we help individuals connect to medication-assisted treatment or medication that could help somebody safely come off of either alcohol or opiates. A lot of people in our community, they don't know that this medication exists. And so what we do is we act as advocates and provide education around substance use disorder here at San Mateo Medical Center and provide linkage to MAT here in the community.
And our hope in the process is to reduce their emergency room visits and increase visits to outpatient primary care appointments or medication-assisted treatment appointments. With the IMAT team, we look to broaden our influence beyond just the emergency room. We go out in the community and do presentations for various groups.
And so one thing that we did do in 2024 is we actually led a series of different science classes over at Cuna Intermediate School in Half Moon Bay, where 8th grade and 7th grade students got the general, what is fentanyl? What are opiates? You know, students ask questions about what they're seeing in the community and what are some really great resources to tackle what they're seeing and what's been happening to their neighbors, their best friends, what they're seeing on TV.
One of the groups that we presented for in 2024 was a youth activities league. What we really wanted them to know was about naloxone and how to reverse overdose. We also wanted them to know about fentanyl and the risks.
On a macro level, there's been more of a need for parents' education, so we have been leading those discussions with parent groups in the county of how to recognize if a loved one is using, of how to recognize kind of what's going on to an individual when they are reaching out for help, how to have difficult conversations and how to really come in a place without any judgment. 2024 really showcased our team's ability to broaden the spectrum when it came to education and specifically targeted outreach. We've noticed an increase in Spanish-speaking referrals and specifically undocumented clients. So one thing that we did in 2024 is that we translate all of our materials into Spanish. And not only that, but we also saw the need to really provide more education on the level of drug use and fentanyl use and kind of what's going on here in San Mateo County. And so one of the things that we did this year was provide education in Spanish to the whole county. We were doing presentations on the coast side to the immigrant farm worker community. We were providing, services and education to the workers, the laborers at the labor center. We were also doing targeted outreach to these populations so that they themselves know how to tackle and how to identify a substance use crisis or how to recognize the symptoms of things like fentanyl. And so one of the things that we also did was partner with different agencies. So this year we partnered with the O team, for example. And so by doing that, we've been able to really branch education on MAT, education on fentanyl, education on life-saving drugs such as naloxone, and have really kicked it up a notch to make sure that we are echoing the needs of the community. So one of the cool things that we did in 2024 was bring on a senior community health planner. So this really eliminated just any barriers that we saw when distributing naloxone or Narcan. You know, back in the day, we used to be almost a little stingy when it came to naloxone, but ever since we introduced that role, our planner has just been an amazing example of how to decrease those barriers and how to pass out naloxone. One of the things that she has been able to do is to partner with different, community partners in making sure that they have access to Narcan. Not only that, but she also makes sure to ask us if we're running low on Narcan here at the hospital. Not only that, but there was an introduction to a Narcan vending machine. They are distributed sporadically and will be distributed sporadically. Right now, we have one over at the jails, but let's say somebody's calling from Redwood City, you know, they can easily go to the lobby of McGuire Jail and get a naloxone kit, which is really cool. So I would say just having that position has really opened the discussion of accessibility when it comes to providing naloxone. And that closes reporting live from SMMC IMAT team.